I'm Gina. I work at the hospital here in Essentia. I am a physical therapist assistant here in the acute care setting. I love what I do. I help people every day. I get to see outcomes every day a little bit each time, and hopefully getting patients back to their independence. So someone being able to complete any functional mobility, so getting up and out of bed, just the act of standing, walking around, even going to the restroom, just being able to do that independently, whether it be with a specific assistive device, meaning walker, cane, crutches, anything like that, that will allow them to be as independent as possible and not have to rely on anyone else to complete those tasks. So we're here to task and help patients become more independent, feel more purpose, more worth, and just be able to be the individual they want to be. So I usually introduce myself and just encourage them to get out of bed, because obviously it's a choice to participate with me. So if they agree, I usually try and get them up, kind of assess how they're moving. If they're capable of walking, I'll try and get them to walk. If they show some lower body weakness, so leg weakness, I'll go through exercises, whether it's bed exercises, seated exercises, standing exercises, just to get them up and moving so we can get them stronger to get them out of the hospital. So usually we set up our caseload, so I get like a list of 12 to 14 people that I need to get through, do chart reviews, and then kind of prioritize each patient of who needs to be seen first, you know, what their discharge needs are, and then kind of go from there. And you know, with the acute care setting, you have to be really flexible, and knowing that even though you planned out your day a specific way, it doesn't mean that it's always going to be that way. And you know, there's different scans that are always popping up, or the patient's busy with a different discipline. So then you just have to move on and try and work through that and get to everyone is the best that you can. So I went to Northland Technical College up in East Grand Forks. They have a 2-year associate's program. Prior to that, you have to have your prerequisites done. So whether you take them during those 2 years or take them prior, it doesn't either or. It's just a busier caseload, obviously, if you do it during your schooling. But yeah, so it's 2 years, like a year and a half of like book work, and then a year for clinical work. So as a high school kid, of course, being in sports, I injured myself, had to go to therapy. I thought it was a really great way to, you know, help people. So, you know, when I first started, I was more aimed towards like the sports therapy part, but then as I grew in my schooling and just finding a career after graduation, the acute care setting really spoke to me, and it's probably the most rewarding job that I've ever had. For those who are interested in physical therapist assistant occupation, like I had mentioned earlier, just reach out and shadow. I guess I really love my job. I find it very rewarding. You can easily find other areas of this PT realm and still find it very rewarding. Yeah, I love everything about working here at Essentia. They make it feel really like home, and making sure that everyone's working together as a team rather than all these separate entities, which is very important here in this acute care setting.